If it was a 30 count of 100 milligrams.
Do you remember writing quetiapine script for 100 milligrams?
I do. I believe the quantity was 22.
22, okay. So on December 7th of 22, you wrote a script for quetiapine, and forgive me, I'm sorry, what is that again?
Seroquel.
Seroquel, for 100 milligrams, right?
Yes.
And why did you write the script on November 30th for quetiapine 25 milligrams and then about a week later increase it to 100 milligrams?
On November 30th, I had anticipated utilizing it over a 4-week course of treatment for sleep and anxiety. But her clinical symptoms, presentations changed, and we opted to use it for mood stabilization.
And who's we?
Me.
Okay. And were you working with anybody else, any psychiatrists or anybody?
No.
So when a person comes to your clinic as a woman who has recently had a baby or is within that postpartum range of time and presents with the symptomology that she presented, is that something that would give you cause for concern? Suicidal ideation?
I in no way want to minimize what Lindsay experienced, but it's common for us to treat.
It's common to treat women in that fashion that are postpartum?
Postpartum who may have suicide. Oh.
Keeps cutting off the witness before she gives an answer. May she complete her answer?
Sure. As I've said before, let's only talk one at a time. You finish your answer, and then we'll go to the question.
Go ahead.
Her symptoms were serious, and it's not uncommon for me to treat women with serious symptoms in the postpartum period.
Okay. 2 days later, you prescribed 8 count 5 milligrams of diazepam. Is that right?
2 days from December 7th?
Yeah, it was December 9th.
December 9th. Yes.
And 4 days later, you prescribed more diazepam. Is that correct? December 13th?
Correct. That would have been 2 milligrams?
Yes. And then jump ahead to December 19th, you prescribed 14 count 2 milligrams of diazepam. Is that correct?
Correct.
And then December 19th, you prescribed 300 milligrams of quetiapine, 30 count, right?
Correct.
And that was on December 19th. 3 days later, on December 21st, you prescribed additional quetiapine, 100 milligrams, 14 count, right?
Correct.
And then 1 day later, you prescribed more quetiapine, 25 milligrams of 14 count, right?
Correct.
As far as your prescriptions continued on, if we can jump ahead, you continued to treat her, and on January 13th, you prescribed 2 milligrams of diazepam, 7 count, right? That would be on January 13th?
I did not prescribe that on January 13th.
All right, if I suggest to you that Rebecca Jollotta has a script for January 13th of diazepam, that doesn't refresh your memory?
Would it have been a script that I had sent previously that hadn't been filled at the original date?
Well, I believe the records would indicate that. We'll make a note of it. January 13th, diazepam. How about January 16th? Do you recall prescribing diazepam to her, 2 milligrams, 3 count?
No.
Diazepam on the 19th of January, 2 milligrams, 14 count.
No.
No? So you're not able to prescribe medications, somebody else can't use your name, right?
Right.
Okay. And you have the DEA license to prescribe medications, correct?
Correct.
Now, one of the things that you went through was a lot of, obviously, it's a little confusing with the names of the various drugs, and the district attorney said to you blithely, she said, well, she's a nurse, so she knows what those drug names mean. Do you recall that question?
I do.
Yeah. And you just said yeah, right? Mm-hmm. So you're assuming that a woman who gets her RN at the age of 24 in a 1-year program and then works for 7 years as a labor and delivery nurse is familiar with these names and what they are, what drugs they are?
She seemed to be familiar with them. Yes, she understood.
Right. Did you know that she was Googling 60, 70, 100 times a night what benzodiazepines are, what Seroquel is, what all of these medications are?
I did not know that.
Did you ever ask her where she acquired what appeared to be, apparently to you, her ability to know what these medications are?
I'm sorry, I don't understand the question.
Well, you wouldn't know the medications that a labor and delivery nurse uses when they're helping a woman who's giving birth, would you?
Not necessarily.
Okay. In any event, one of the things that you left us with is the fact that you were very, I think the word was invested in Lindsay Clancy and were concerned about her treatment, right?
Correct.
You knew that she had gone to the Rhode Island program for Women and Infants Center, Behavioral Health Day Program in Providence, Rhode Island. You knew that, right?
I did.
And you basically gave her the referral. You didn't make the referral. I think it was Latasha Dukes that might have done that.
Correct.
So you were aware of the fact that a recommendation was made to Lindsay that she reach out to someone else for help, right?
Lindsay made me aware of that, yes.
And she needed help, didn't she?
Yes.
And she went to Women's and Infants Hospital on December 20th, right?
She did.
And was she treated at Women and Infants?
I don't believe so.
Why not?
I wouldn't want to speculate or assume, but it seemed to be her intake appointment.
Her what?
Her intake appointment.
Okay. So without assuming or speculating, you referred her to this provider, right?
Yes.
So you have this woman who you know has been seeing Dr. Tufts, a psychiatrist, right?
Right.
You knew that. You didn't get access to Tufts' records. You didn't know what Tufts was doing, but you knew that for a period of time before she saw you, she was dealing with a psychiatrist, right?
Yes.
You knew that she was a woman who had just given birth like 5 months ago, right?
Yes.
You knew that she was obviously in trouble. She was sick, right?
Yes.
You told us that she was suffering from, and your words were, a mental health illness that was very real. And you told her that this will get better. And that was in December of 2022.
Yes.
So when you referred her needing help to this Women's and Infants program in Rhode Island, and she went because that's what she was told to do, what happened at Women and Infants program?
I can't speak to what happened at Women and Infants
Why not?
because I was not a part of that assessment.
What does that mean?
I did not see the assessment, and I did not speak with Dr. Diaz.
Why?
Lindsay had informed me that she was going to be at the program for 2 weeks.
She was hoping to be at the program for 2 weeks, right?
She told me she was going to be at the program for 2 weeks.
But she was turned away after about 8 hours of sitting there in an assessment and sitting in a group session. And she was turned away because of their concern that she was suffering from, well, let me ask you, what was their diagnosis?
I'm not sure.
Did you ever find out?
I have not.
Does it matter to you as a treating person that I think your words were is invested in Lindsay Clancy?